How to interpret complex amniocentesis, genetic reports. Have you ever wondered how to make sense of those complex amniocentesis genetic reports? If you are expecting a baby or planning for one, understanding these reports can be very important. Let's break it down into simple terms so you can feel more confident about the information you receive. Amniocentesis is a procedure that analyzes a sample of amniotic fluid. This fluid contains fetal cells and is used to detect chromosomal abnormalities and specific genetic disorders. The results can be categorized as either normal or abnormal. A normal result means that no chromosomal abnormalities or specific genetic conditions were detected. On the other hand, an abnormal result indicates a chromosomal change or genetic mutation, such as trisomy 21, which is also known as Down syndrome. When you receive your report, there are several key components to look for. First, chromosome analysis, also known as karyotyping, detects large chromosomal changes. This part of the report usually provides clear results, either normal or abnormal. Next, there is chromosomal microarray analysis, which identifies smaller chromosomal deletions or duplications that may not be visible through karyotyping. This analysis can reveal copy number variants, which may or may not have clinical significance. Targeted genetic testing is another important aspect. This test looks for mutations in specific genes that are linked to known inherited disorders. The decision to perform this test is often based on family history or findings from an ultrasound. Exome sequencing is a more advanced test that examines many genes at once. It is particularly useful for identifying mutations that may cause structural or growth anomalies in the fetus. It is also essential to understand the limitations of amniocentesis. This test does not detect all genetic conditions or birth defects. Some abnormalities may require additional testing or follow-up. You might also see results that indicate variants of uncertain significance. This means that the clinical impact of these findings is not yet clear, and consulting with a genetic counselor is advisable. To interpret a complex report effectively, start by reviewing the reason for the testing. Why was amniocentesis performed? Was it due to advanced maternal age, abnormal screening tests, ultrasound anomalies, or family history? Next, identify the tests that were performed. Each type of test, whether karyotyping, chromosomal microarray analysis, or gene panels, provides different levels of detail. Then, take a close look at the reported findings. Are there any identified chromosomal abnormalities, gene mutations, or variants of uncertain significance? Consider the clinical significance of the findings. Some results may predict well-known syndromes with established outcomes, while others may be less certain. It is always a good idea to seek genetic counseling. A genetic counselor or specialist can explain the results in detail, discuss their implications for your pregnancy, and guide you in making informed decisions. Finally, plan for follow-up. Depending on the results, additional tests or consultations with specialists may be recommended. Understanding complex amniocentesis genetic reports can feel overwhelming, but by breaking it down into manageable parts and consulting with professionals, you can gain clarity on what the results mean for your family's health.